Welcome to the Healthcare Technology Report, a leading information source on healthcare technology companies and solutions. Today, we speak with Tylon Wang, co-founder and CEO of Angle Health, a full-stack AI-enabled health plan founded in 2019 to reimagine employer-sponsored healthcare. Angle Health provides small and medium-sized businesses with access to fully customizable health plans that integrate telehealth, digital pharmacies, behavioral health, and other services previously limited to large employers. The company now operates in more than 40 states, serving thousands of employers and tens of thousands of members nationwide. I'm your host, RJ Lumba. We hope you enjoyed the show. If you liked the episode, click to follow. Ty, thanks so much for taking the time to chat with us today. It's a delight to be with you.
Thanks so much, RJ. Great to be here.
Where I'd like to kick off is actually how you uncovered this issue. I guess it was probably known to exist, this cumbersome process of finding the right health insurance, but maybe tell us a little bit about the backstory for you founding the company.
Yeah, that's a great question. So my co-founder and I, we started Angle Health. It's been about 5.5, almost 6 years now, but it really came from our own experiences and experiences with our family in terms of accessing healthcare and navigating the healthcare system. And for me personally, so I grew up in a relatively low income family. My parents were immigrants to the US and they worked blue collar jobs their entire careers. They were the kinds of people that couldn't do things like afford to take time off work to go to in-person doctor appointments. It wasn't until going to a company like Palantir, where my co-founder and I worked out prior to starting Angle Health, that I saw kind of the stark difference in kind of what was out there and what's available to people in certain walks of life versus others. And this was also kind of a time where if we look at over the last 10, now 15 years or so, we've had this explosion of new ways of receiving medical services, things like telehealth and telemedicine and digital behavioral health programs and chronic disease management programs and digital pharmacies and all of these tools and services that make accessing healthcare much more convenient and should make it more accessible to people. But one thing that we realized was that even though these services exist now, the people that really need access to them, that could really benefit from many of these services, don't have access to them because a large piece was primarily how these services were distributed, where even today, when you take a look at like any of these digital health or chronic disease management programs, they're still delivered, and a significant amount of the revenue is really still driven by directly contracting with these large employers who are paying them 6, 7 figures a year for their employees to access these services. But when you really peel it back and look at who's able to afford and pay for these services, it's not the companies that are employing the people that really need access to them. So a great example is when I was at Palantir, we had a few of these services as benefits, for example, a lot of health. But when you kind of take a look at the population of these big tech companies or like these large financial institutions or law firms or these kinds of companies that are offering these kinds of benefits to their employees, those employees are generally not the people that, again, need access to these kinds of services. It's not your manufacturing companies or your restaurant chains or your retail stores or the places that my parents worked that could afford to pay these companies 6, 7 figures a year to offer that to their employees. But those are the people that really need them, people like my parents. So we realized that one of the big issues here, and it's not that health plans and health insurance companies don't want to be able to offer these kind of services to their members, but it's really a difficulty in kind of truly integrating these kinds of services. And many of these are clinical services into core care navigation and access for these members. So we realized that the only way to kind of bring about what we would consider a modern tech-enabled experience when it came to accessing healthcare benefits and to really democratize access to these services to the people that need them was to rebuild this health plan stack from the ground up. And that's what we've done with Angle Health. And I think we're all really proud to say that today we serve thousands of small and medium-sized businesses and are able to deliver and engage our members into the kinds of services that are improving their health outcomes, improving their financial outcomes, and delivering them services that historically they never would have had access to.
Hmm. So sounds like it was the case that prior to you starting Angle, it would have been very difficult for a small, medium-sized restaurant to be able to offer this menu, no pun intended, of digital health services to their employees.
Yeah, yeah. Whether it's digital health services, what we're able to deliver today are fully custom health plan products to these small and medium-sized businesses. So you can think about when it comes to even customizing the plan designs themselves, things like cost shares, copays, co-insurances, deductibles, out-of-pockets, the provider networks, the pharmacy networks, the telehealth and telemedicine services, and these additional digital health services. These are all things that we now allow our customers, our employers, and the brokers and agencies distributing Angle Health to really design for their clients and for their employees. And that level of customization, this is a market that is used to very rigid, really only has access before access to these kind of very rigid plan designs. They have kind of a fixed menu of a couple options that they can choose from and that they can offer. And they're faced with double digit renewal increases year over year on these fixed set of options. We've been able to really unlock for these SMBs what historically was only accessible to a bunch of larger companies. So I think companies with like 1,000, 5,000 plus employees that are fully self-funded and that have the resources and whose vendors have the incentives to deliver kind of a custom flexible product to these employers. We've been able to bring that all the way down market to these companies with 10, 20 employees.
So the insurance products were being offered. It's just that they were never reaching the audience that needed it most.
Yeah, yeah. And a big piece is I think we all know that one size fit all doesn't really meet the needs for everyone. Like we're really moving into an era, especially with AI and with all these new ways of receiving medical services, we're moving into this kind of era of very personalized healthcare. And Angle Health is really kind of on the forefront of delivering that experience to definitely down market to these small, medium-sized businesses that make up kind of the fabric of America and otherwise would really be kind of left behind and still stuck with the very rigid kind of one size fit all products that they've been used to and that incumbents really have no incentive to change.
Hmm. Now, tell us a little bit about where you are in the company journey. How has your adoption rate been? And I know you have different clients, so to speak, in terms of client types, but tell us a little bit about where you are in the kind of company growth process.
Yeah, so we've been around now for over 5 years. Today, we're a truly national health plan. So we're operating in 40 plus states today. We have thousands of employers that are customers. We have high tens of thousands of members across the US, and we're growing. Historically, we've grown over 3x year over year. We're continuing to grow at a rate of around doubling every single year still. So we're one of the fastest growing health plans in the nation, if not the fastest. And we're being trusted by many of the largest brokers, general agencies, benefits consultants, household names that many business owners, many consumers have heard of today. So we've really been on a really exciting journey of growth, and we're the most financially stable that we've ever been, which is something that I think is rare. We've seen companies in our space, we've seen startups in our space blow up, and we'll have some exciting announcements in the near future here.
Excellent. Well, would love to learn a little bit more about your background. You talked a little bit about your upbringing, your parents. You went to Wash U. You are able to work with Palantir. How did that all come about? Where are you from originally?
Yeah, so I grew up in Colorado. My parents, like I mentioned earlier, they immigrated here in the late 70s, early 80s, and we moved around a lot when I was a baby. My parents moved around a lot. They were entrepreneurial, but out of necessity. It was what they needed to do to be able to put food on the table for my sister and I. And I think What is truly amazing about, and I think what really drives me to build a company like Angle Health, and even drove my prior career, both at Palantir and before that, I actually worked for the federal government for several years, was I strongly believe that this is the greatest country on earth, and there's really no other place where you can go from within one generation being kind of entrepreneurs out of necessity to now me being in a place where I can be an entrepreneur out of choice. So my parents obviously worked extremely hard to be able to provide the kind of life that I'm able to have today. I mean, it wasn't without a lot of sacrifice on their part, both on kind of their time and their health, where my parents have multiple chronic diseases. And I think that the entire experience of growing up there and seeing kind of how hard they had to work and what they had to do to make sure that my sister and I could have an education and be where we are today. My sister is a doctor now as well, was a very defining kind of experience, and is what I think drives not just myself, but I think a lot of our employees here at Angle Health have had similar experiences or had experiences with personal or familial challenges with the healthcare system and are really looking to do something kind of truly meaningful, build a company that's truly meaningful.
One of the topics we like to touch on is investors and how they've perhaps added value to you and your management team and your company aside from financial capital.
We wouldn't be here today without the support of our investors. Obviously, there's the financial piece, but also I would say the strategic guidance and the relationships that they've been able to unlock and the credibility that they've been able to afford us in the marketplace. One of the interesting things about our business, and I think one of the areas where it's not entirely, but many of the biggest companies in the world are large insurance companies, and a sufficiently large insurance company is essentially a large asset manager. So when you're talking about venture capital, private equity, any sort of capital allocation business, there's a good chance that there's a major insurance company or a large insurer that is providing some of that capital. So I would say that from both from across commercial relationships, across financial relationships, and some of the financial tools that we have in place today to support our business have really been tools that we otherwise wouldn't have been able to access.
Mhm. We're heading up on the tail end here. I have two final questions. One is, can you tell us about a person who has had a profound influence on you? You mentioned your parents a couple times. Maybe if there is another person, just for the sake of providing a bit more color as to your influences, you can mention another person.
That's a good question. Obviously, I think, like I mentioned, my parents have had pretty profound impact. I think outside of them, I would say it's really a lot of the people that I've worked with, both our employees over the past couple of years, building Angle Health, as well as my colleagues and peers that I worked with at Palantir and for the federal government before that. I think one of the things that has been consistent across all of these experiences is just the level of conviction that people have in what they're doing. And I've always worked for highly mission driven organizations. And I think being around that, constantly being around that, and knowing that there are a lot of extremely smart people that are looking to do things that will really make a difference. I think that has always been a huge motivator for me. And I think that has really kind of shaped how we think about what we're doing at Angle Health and the meaning behind it and what's important to prioritize.
Excellent. Last question. Can you tell us a little bit about what you do outside of work? How do you recharge?
That's probably one of the hardest questions that I've been asked. There's not a lot of time outside of work these days, but I like reading a lot. I'm a big reader, and I actually have this group with a couple friends that I've known for a long time. One person will select a book every quarter or so, approximately, and it's kind of like a book club, basically. But we generally read nonfiction, books about leadership, things like that. And outside of that, I'll go through phases of doing very religiously is the New York Times crossword. So I think that should count.
Excellent. Well, Ty, want to thank you again for taking the time to chat with us today. It's been a wonderful conversation.
Thanks, RJ. It was fun. Great to be on here.